Imagine your home blood pressure monitor as a tiny truth meter for your arteries. If you use it wrong, it becomes a tiny liar. The good news is you can fix it fast. And yes, it can change your care plan in the United States. Here is why this matters. Many U.S. clinicians confirm high blood pressure using home readings before changing meds. If your numbers are wrong, your diagnosis and treatment can go the wrong way too. Think of it like baking bread with a broken oven thermometer. The recipe is perfect, but the loaf still flops. Mistake 1. Using the wrong device. Wrist and finger monitors are like measuring your shoe size with a banana. Easy to grab, not built for accuracy. Use a validated automatic upper arm monitor. There is a website called validatebp.org that lists models proven to work. Bring your device to your clinic once a year to compare it with their machine. If it consistently matches, you can trust it at home. Mistake 2. Wearing the wrong cuff size. Cuff size is like jean size. Too small and everything feels tight and the number goes up. Too big and it's fast and the number can drop. Measure the middle of your upper arm, check the manufacturer's chart, and get the cuff that actually fits. If you are between sizes, consider getting the alternate cuff so you are not squeezing or swimming. Mistake 3. Sloppy posture and arm position. If your feet are dangling, your back is unsupported, or your arm is hanging low, you are basically doing squats while trying to read a thermometer. Sit with your back on the chair, feet flat, and legs uncrossed. Place your bare arm on a table so the cuff sits at heart level, about where a name tag would pin on your chest. Do not talk, hum, or debate sports while the cuff inflates. Silence helps. Mistake 4. Skipping the 30-minute rule. For 30 minutes before you measure, avoid caffeine, alcohol, tobacco, and exercise. Empty your bladder, then sit quietly for at least 5 minutes. Your arteries need a short, do not disturb window. Coffee, cardio, or a full bladder can push numbers up like someone leaning on a bathroom scale. Mistake 5. Measuring over clothing. Putting the cuff over a sleeve is like trying to listen to a whisper through a pillow. The cuff belongs on bare skin, about an inch above the elbow crease, with the artery marker lined up along the inner arm. If your sleeve is tight, do not roll it up and make a tourniquet. Take the arm out of the sleeve. Mistake 6. Taking one quick reading and calling it a day. Blood pressure bounces around, especially with movement, stress, or a random thought about taxes. Take 2 readings, 1 minute apart, and average them. To learn your true usual pressure, measure morning and evening for 3 to 7 days, 2 readings each time, and average all of them. Share that average with your clinician, not the single wild outlier from the day your dog ate your sock. Mistake 7. Switching arms after day 1. Arms can differ like left and right shoes. On day 1, measure both arms correctly. Use the arm with the higher average for all future checks. If your systolic numbers differ by more than 10 to 15 millimeters of mercury over and over, tell your clinician. That gap can be a clue to a vascular issue that deserves attention. Here is the 60-second home blood pressure ritual. Create a 30-minute clean zone with no caffeine, alcohol, smoking, or exercise. Empty your bladder. Sit with your back supported, feet flat, and legs uncrossed, and rest quietly for 5 minutes. Put the correctly sized cuff on your bare upper arm and align the artery marker. Support your arm at heart level on a table or a pillow. Stay silent. Press start, wait, then repeat once after 1 minute. Record the average. Buying a home monitor in the United States is simple if you follow a short checklist. Choose a validated upper arm model. Make sure the cuff size matches your measured arm. A memory function or phone app helps you export readings to your primary care clinician or patient portal. Bring your monitor to your next visit so the staff can compare it to the clinic device. If you have an FSA or HSA, ask whether your purchase is eligible. Know when numbers are urgent. If you see 180 over 120 or higher, sit quietly and recheck in a few minutes. If it stays at or above 180 over 120 and you have symptoms like chest pain, shortness of breath, severe back pain, weakness or numbness on one side, vision changes, or trouble speaking, call 911 immediately. Do not drive yourself. Do not wait for it to settle down. Pro tips to make this painless. Measure at the same times each day, like before morning meds and again in the early evening. Use the same chair and the same table so your setup is consistent. Warm your hands and take a couple of slow breaths beforehand. Cold or tension can nudge numbers upward. Use a pillow or folded towel to keep your forearm at heart level. Rename the user profile in your device to left or right so you never forget which arm to use. Set a phone reminder that says, blood pressure, 30-minute clean zone. Pack your cuff when you travel and switch to local time the next day. When you message or visit your clinician, share your 3 to 7 day averages for morning and evening, the arm you use, your device model and cuff size, and any symptoms or medications that might affect readings, such as decongestants. That set of facts helps your team follow U.S. guidelines and decide whether you need lifestyle changes, medication adjustments, or remote blood pressure monitoring. Quick recap. Use a validated upper arm device with the right cuff size. Respect the 30-minute clean zone and the 5-minute rest. Sit correctly, keep the arm at heart level, and stay quiet. Take 2 readings 1 minute apart and average them. Confirm with a 3 to 7 day morning and evening plan. Use the higher arm and report large arm-to-arm differences. Know the red flag symptoms and act fast if they appear. Dial in your technique and your home numbers become trustworthy medical data your U.S. care team can act on. Accurate beats anxious every time.